Well, let's take a look at that lead story. The Human Rights Commission says that poor health care and management led to the deaths of 6 babies at the Thello Mogoerane hospital in Gauteng's East Rand.
The infants died from an outbreak of Klebsiella. The Commission says it will assist families of the deceased in any legal matters. They visited the hospital along with the unions to investigate if any human rights were violated.
Ward 2, Thello Mogoerane Hospital. It's here where the deadly bacterial disease Klebsiella infected almost a dozen children.
It's 12 babies and then 6, they've passed away, and then 1 was treated, discharged 1 to Charlotte Matreke, but was treated and was 1 negative to Charlotte Matreke, and then 4 they are still here.
The multi-drug resistant infection was hard to fight with normal antibiotics, and this was made worse by overcrowding. The neonatal ward's capacity was 69, but during this time it bedded 90 newborn babies, putting pressure on the already limited resources.
It's affecting the staff in such a way that they are getting tired, and some you can see they've got burnout. Yeah, when she's got a problem, when you try to interview, you find that the person just scream. You can see this person is having a problem.
According to health officials, the fatal outbreak began in July, but unions say otherwise. According to DENOSA, the outbreak did not start in July, as stated by the Gauteng Health Department as well as the Ministry, but as far back as May.
When we started this issue in May to start to engage the management, already nurses in the unit were complaining that there are deaths, and the manner in which the babies are dying, it is unusual, something should be wrong, and we started reporting. And from that point on, only the first case was picked up in July, the 1st of July. But between May and June, nothing was done and nothing has been picked up.
The Human Rights Commission says these deaths are a violation of access to health care. They plan on instituting legal action.
The Commission, going forward, will assist the families of the deceased babies. We will, with legal options, to seek compensation from the department. We are more than willing to play a mediatory role so that these families don't even have to get legal representation elsewhere.
On Sunday, the Health Ministry announced the neonatal patients would be moved, but 3 days later, 59 infants remain in this busy ward. Hasina Gori, SABC News, Vosloorus.